Hi everyone, welcome to the Physio Tribe. Have you ever wondered why you connect better with some of your patients than the others? Or have you noticed why some patients, despite going to experienced physios than you, still prefer to come back to seeing you? Now, as humans, we are hardwired for connection, and we like to go to people who understand and relate to us better. I am Fernandes, and I've been working as a physio for the past 8 years, predominantly in musculoskeletal private practice. And today, I would like to share with you the second core skill we all need as physios in order to build connection with our patients and get better outcomes. That skill is none other than empathy. I remember going back to the first year when I was practicing. I had a home visit. This patient was a stroke patient. Now I was seeing her twice a week for a period of 6 to 8 months. During the process, I established a bond with her. She was approximately 75 years old. Now this was not far long after I had lost my grandma. To me, empathy was putting myself in someone else's shoes. I assumed I knew what it was, and that's what I did. I seen her as my grandma. And once she was not compliant with her exercises, and I threw a fit, like we do with our family members when they ask us for advice. Not knowing what I did back then. A few weeks later, I got a call from her husband saying that she's unwell and to not visit her. I waited for 2 to 3 weeks after, and then when I rang back to find out why she doesn't want therapy, he said that she wasn't feeling comfortable to see me anymore and she was deeply hurt. I was really taken aback by what happened back then. But since I had no feedback and no supervision, this being my first visit in my first year of work experience, I was really disheartened and had a feeling of guilt. I was wanting to know why, what went wrong, and why was I not taught of how could I approach this better. So I researched a few articles and skills over the years, and I would like to share some of what I came across and summarize it for you in this small video. Now, an article by Carol Davis says that empathy is a skill that cannot be taught. It can only be facilitated. Edith Stein describes empathy to occur in 3 stages. The first stage is that of active listening, where you let the clients talk. You nod. You portray good open body language where they feel like talking their heart's content to you. The second stage is a stage where you merge with what the client is feeling. It's a very deep sense of emotional connection that you reach a place where the client has been, and that could be pain or something else. The last stage is that of sympathy, where you come back out of that deep state of being with the client and be yourself, but just beside the client. And you tell them that I can feel what you can feel. Now, after I learned of this model, I realized that with that patient or that experience of mine, I was probably stuck in this stage and didn't know what to do to come out. Now, Edith Stein also describes that the second stage is something that just happens. It happens naturally to some of us. He describes it as a state of falling in love, where you don't know how it happened, why it happened, but it just happens. So it's very important for us to identify when it happens and what to do to come out of it. Now, as new grads, studies have shown that we are very self-consumed in how we perform, in our knowledge of anatomy, physiology, whether we sound good to the patient, whether we are going to make a good decision for the patient. So we are very self-consumed, which makes it hard to execute whatever it takes to be empathetic. Now, of the 3 stages they describe, the first and the third stage can be learned. The first stage is where you learn how to listen and not talk and interpret. And the third stage is where you identify with certain commonalities which you share with the patient, like playing a sport or having a loss of a loved one, and you can understand where they're coming from. So I encourage you all to go back and reflect on your practices. Be self-aware of your own strengths and weaknesses. Improve on skills you are not confident at in order to build your self-esteem, build your self-confidence. So you are less anxious and less fearful, and hence fully present to be there and connect with your patients. The tips I would like you all to take from today's video is that of being very curious of the next client that walks into your door. Because if you genuinely are curious and wanting to know more about a patient, you automatically become an active listener, you ask reflective questions, and you come across as non-judgmental. And if you come across that way, all your clients will feel very comfortable to connect with you. I hope these tips have helped you. Please like and comment if they have, or share this video with someone whom you think would benefit from it. Thank you for your time. Stay safe. Catch you all later. Take care.